Hi everyone, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Did you know that your feet play an important part in the way you walk and also in the function of your legs and the comfort and well-being of the rest of your body, especially your spine? Altered foot function and structure and the imbalance of that structure can result in significant changes to gait or the way you walk and your posture. These changes will inevitably impact the pelvis and the spine, resulting in chronic spinal complaints and also poor response to chiropractic care. So that's why you need to understand the gait cycle, have a basic awareness of it, and of pronation, hyperpronation, and supination movements of the feet. And this will help you not only walk better, but also have better results with your chiropractic treatment for your back pain. So the gait cycle, or the cycle in which you walk, you take one step after another, is divided into several different phases. There's the stance phase and the swing phase. So the stance phase, that's 62% of the gait cycle, describes what happens to the foot mechanics during weight bearing. So this is when your feet touch the ground and support the weight of your body. The swing phase is the non-weight bearing part of the cycle, and it's 38% of the gait cycle. So that's obviously where your foot is up in the air. You're not doing any weight bearing. So as a chiropractor, I'm concerned most with the stance phase, and that can be divided into three different periods. There's heel strike, where your heel touches the ground, the mid stance, where the mid part of your foot touches the ground, and then also with toe off, where you're preparing to lift your foot off the ground. So pronation during contact helps to absorb shock and also compensates for walking surface irregularities in the ground. And then supination then stiffens the foot for spring off from mid stance into propulsion. So pronation is basically where you're rotating your foot outwards, so the soles of your feet face outwards. And then supination is where the soles of your feet face inward or face each other. So if you're sitting in a chair and you touch your feet together so that your soles touch each other, that's an example of supination, hypersupination, or supination to the most extreme degree, if you will. So that gives you an idea of what pronation and supination look like and what they feel like. So problems arise when when people pronate excessively, that's hyperpronation, or supinate excessively. So biomechanical problems due to hyperpronation are by far the most common ones that I see in my practice. So some excessive pronation or hyperpronation problems that might be encountered are flat feet, arch pain, bunions, neuromas, heel spurs, rotation of your kneecap towards the midline, towards the inside, anterior pelvic tilt, that's where your pelvis tilts forward, and this leads to lower back problems, and functional scoliosis, that's another one. Scoliosis is a sideways curvature of the spine. So this happens then when you're hyperpronating, you have excessive pronation, you have a flared foot. In other words, you're walking with your toes out. For example, a runner with a size 10 shoe and 25 degrees of foot flare runs an extra 31.3 yards per mile due to the foot flare aspect of the pronation. So when the biomechanical fault is corrected, then performance will improve. Also, Achilles tendons are bowed inward with hyperpronation, and that leads to tendonitis. It can also cause pain. So once again, hyperpronation is the collapse of the inside or medial structure of the foot, and it results in an outward lateral rotation of the foot's axis. So again, your soles are facing outwards, sideways. And this rotation causes a lateral shift or sideways shift in the point of impact of your heel. And support and control with a medial heel wedge, for example, so you put a little wedge on the inside of the foot in the arch. This is indicated at this point, and it decreases the excessive tilt of the heel bone. And exercise to increase your shin muscles on the front of the leg, front of the shin, will also strengthen and aid in the return of the foot to proper balance. And then chiropractic adjustments to correct your pelvic alignment and spinal subluxations, spinal misalignments, and also a conscious effort by you to correct your gait and really being conscious of your gait. This also is beneficial. So that's why I recommend orthotics in my practice, and foot orthotics are so important. I'm not talking about the type you buy in the drugstore, CVS or Rite Aid, for example. Those are flimsy and they don't provide adequate support. I'm talking about custom orthotics. Now, true, they're a little bit more expensive, but they work, and they're tailor-made to the shape of your foot and your stance, your posture, and are designed to correct that. So I identify my patient's gait and look for dysfunctions there. I establish a proper and effective treatment protocol, make custom orthotics, and then that, along with proper chiropractic care, ensures that ankle and foot problems and back problems go away as well. So once again, we're available for complimentary consultation to see if this is right for you, and check out our website at newhopechiropractic.com. Have a great and healthy day.